Hello, this is Paul Chek. Welcome back to my Movement as Medicine series. This is part 2 on mobilization. To begin, I'd like to give you some references so you know where to go and learn more. First, my Golf Biomechanics manual has quite a comprehensive section on stretching and all things related to that. In other words, the different types of stretching. There are a significant number of neuromuscular mobilizations or Feldenkrais exercises, foam roller techniques, and things that you can use to improve overall body function that are congruent with what I'm sharing here. Don't be fooled by the title. This book is written with the assumption that everybody that has a golf club out there has a dysfunctional core, a dysfunctional spine, and probably has neck and back pain. Therefore, the grand majority of the book is applicable to anybody who wants to have a normal, healthy body, which is the first requisite to being a good golfer. This book goes deeper in many aspects, such as length tension testing, which means flexibility testing and joint mobilization, than my book, How to Eat, Move, and Be Healthy. How to Eat, Move, and Be Healthy also has Feldenkrais exercises, stretch testing, stretch techniques, all of which are components of effective mobilization. So with that in mind, we can begin. Our first method or tip for you is a message from Vern. Vern has about 120 joints and something like 400 pairs of muscles. And Vern would like you to know that research clearly shows that any one joint in the body can create a kinetic effect on every other joint in the body. So what does that mean? It means, for example, that if you have blockage in your foot joints, any of these joints, it can cause a dysfunction anywhere through the kinetic chain, all the way up into your head and your jaw. So your first tip when it comes to mobilization is not to fall into the trap that is so common today in believing that the problem is where the pain is. As I'll show you, the problem's quite often not where the pain is. It's a symptom of a dysfunction somewhere else, which is probably far more common in clinical practice than actually the problem being where the pain is. So, as is usual in my approach, we have to look at these things holistically, or you can end up thinking you're doing yourself favors and getting temporary relief of pain, but actually exacerbating a problem and maintaining a compensation pattern for potentially long periods of time, only to do yourself more harm than good. So that out of the way, my next important comment is, remember these YouTube clips that I share, they're just very brief sound bites. It would be a big mistake to think that because you're watching the YouTube clips that you actually have learned what I teach in my more advanced training programs, such as Exercise Coach through Level 4, HLC 1 through 3, and the Golf Biomechanics program. Those programs are very in-depth. Believe me, I wouldn't just give the whole program away. I'm sharing enough to teach you something you can use, but to enlighten you to the fact that there is a lot more to learn. An example of that is this. Here is the Chek totem pole. The Chek totem pole is a series of symbols that represent different functions in the body. The bird represents the psyche, breathing, mastication or eating, vision, auditory, vestibular or balance functions and hearing, upper cervical function, digestion, elimination, limbic emotional function, sacral interaction with the nervous system, and down below here you see the hips, the shoulders, hands, wrists, knees, feet, and all the joints from C3 all the way down to L5. Those are called slave joints. Those are called slave joints because those are the ones that will respond to any compensation induced by the systems higher up. The higher up you go in the totem pole, the more power there is in that system to control the systems below it, because the more high the totem pole section is, the more essential it is for your survival. So the nervous system's oriented around sacrificing lower order systems to keep higher order systems online. For example, breathing is the second highest symbol on the totem pole. Breathing is the most essential function in your body without which you'll die, but the psyche is even more powerful than breathing because you can choose to take your own life by committing suicide and override the breathing function. So the mind turns out to be the most powerful system that controls all the systems. But when it comes to joint mobilization, what's very, very important, and stretching, and therapy in general, if you don't understand how to assess these systems, you can just be on a wild goose chase, seeing therapists, doctors, chiropractors, osteopaths, and everybody else, having your body played with at potentially great expense and potentially irritating the system and treating symptoms. So the Chek program is a very comprehensive program that teaches you how to use the science of holistic health, integrated exercise, and how to work with multiple different types of health and medical practitioners so that, for example, exercise professionals know who to refer to for what types of problems, so everybody understands what the scope of their license is and how to use the other professionals in a multidisciplinary approach. So it'd be a mistake to think that I am teaching how to do it all by yourself in a few minutes on YouTube. Certainly many of you have recognized that by applying little things you get a lot of benefit, but I want to make sure you understand that these are just tips to help you get along better, but my ultimate intention here is to teach you that there's a lot more to learn, and I would love for me and my instructor to support you if you want to really master your body-mind. That said, let's talk a little bit about mobilization, and hopefully I can share some things that will be supportive of your desire to be healthy, functional, and whole. So when we look at mobilization, we're looking at the normalization of muscles, connective tissues, cells, fluids, and joints to improve functional synergy, which means the functional interactions of the one part of the body with the other parts, energy flow, and chakras. Now remember, you have 7 major chakras, which most of you are probably aware, especially if you watch my YouTube clips. And then each joint in your body is what's sometimes referred to as a minor chakra. Every one of those joints is an energy center that produces energy that can be utilized by glands, organs, cells, systems, etc. And anytime we have a blockage in our structural system, we have a blockage to the natural flow of energy, which, to give you sort of a visual, would be, imagine if you were a farmer and you had to irrigate your crops and you had a blockage to the flow in your ditches and you could not get water to certain crops. Well, just the same way you can have a blockage in a joint and it can disrupt the flow of circulation, it can disrupt the flow of energy, it can disrupt the flow of lymphatic fluid, it can disrupt the flow of kinetic energy, it can disrupt the flow of thermal energy, etc. The same way the farmer who can't get water to the crops is going to have a bunch of dead crops. When you have a blockage in joints, you often see a progressive change in the tissues surrounding the joint and in related areas, leading to necrosis and long-term pathology if you don't address it effectively. Now, what are some of the tools? Well, tools that are commonly used are things like your hands, foam rollers. Foam rollers are not all created equal. These are ethafoam, E-T-H-A foam, which I highly recommend for joint mobilization purposes. When you want to do joint mobilization along the spine, you want to use a 4-inch roller. If you use the 6-inch rollers, they cover too many joints at once. So if you get too much surface area on the roller, too many joints are on the roller and you cannot get any specificity in mobilization. So for the spine, the 4-inch ethafoam roller is better. For general tissue mobilization, you can use a 4 or a 6-inch foam roller. There's many other tools. Here's an example of some tennis balls that are taped together that can be used to mobilize the feet, mobilize the spine. There's a variety of methods out there. Straps are commonly used. and then you have specific equipment. I didn't bother bringing the specific equipment out here because it's expensive and it's technical and it's dangerous to use if you don't know how to use it. So those are your basic tools. Now when we look at the way the body works, there's a few key things. Now I'm talking about the spine first and foremost because the health of the spine is the greatest influence on the health of the extremities. Rarely ever do I see a shoulder or a knee injury or a hip injury where a person has normal core function. And I've rehabbed more of these things than I can count, and I probably could count on one hand in 30 years how many people with ACL injuries, PCL injuries, hip capsule injuries, degenerative changes, etc. had normal core function, and you cannot restore joint mobility or normal function if you do not have normal core function, because the core essentially regulates the function of the joints, as do all those other systems I just showed you. So the key things we want to pay attention to here is the psyche is basically imprinting your emotional and mental view of yourself into your body. So if your mind and your emotions are challenged, or if your mind is rigid, your body is likely to express rigidity. If your mind's all over the place, then you're likely to have energy that's all over the place, which usually causes people to brace against themselves and can lead to all sorts of problems. So remember, as above, the psyche, so below. The body always mirrors the mind. The body does not have any mechanism for lying. That's an intellectual process. So you can trust that what your body is mirroring back to you is authentically true, and it's a better idea to identify what's causing joint restrictions and soft tissue restrictions than it is to keep treating them, which would be no different than taking aspirin for a headache and not addressing the actual cause. That said, we also need to remember that the visceral system, your glands and organs, are significantly higher on the survival totem pole than the joints and the muscles that control them as a general theme. So anything going on in the digestive, eliminative, or gland and organ systems is very, very likely to produce some dysfunction in joint and tissue function. And I would say that that's not sometimes, it's always the case. It's just the magnitude of the dysfunction varies depending on the degree of, shall we say, psychic entanglement. Now, when it comes to joint mobilization, there's a few key things we need to look at. These red circles represent what are called transitional zones in professional rehabilitation, such as physical therapy, chiropractic, osteopathic, etc. Transitional zones are where you have a change in the structure and the function of joints. For example, the cervical spine functions differently than the thoracic spine, which functions differently than the lumbar spine, which is different than the sacrum, which is a bunch of fused bones, which is different than the coccyx. So whenever you have a transitional zone, thoracic becoming cervical, cervical becoming upper cervical fusing with the occiput, you then have areas where the body is most likely to compensate. Those are the areas where the body makes the biggest compensations for any imbalance above or below. So if you have too much thoracic curve, kyphosis, you're likely to have stress here in the C7-T1 junction, and that stress can easily overflow into any of the junctions above or down below. These areas are the most common regions for hypermobility, too much movement in joints, which produces pain. Hypomobile joints rarely ever cause pain. You're highly unlikely to have pain in a joint that has restricted movement. You're very likely to have pain in the joints above or below the restricted movement that create the pain. So one of the biggest mistakes is people keep mobilizing hypermobile joints because they get a little pain relief due to the manual manipulation of tissues and other factors I don't have time to explain. But this is actually very likely to be irritating the problem. In order to do the job effectively, you have to identify where the joint restriction is, and that requires assessment by a skilled professional. Chek practitioners are taught very comprehensive techniques for identifying exactly where the problem is coming from and which systems may be causing the problem. So, in review, occiput, atlas, base of your skull, C1, C2, 3, C7, and T1 up to T3, and sometimes even more depending on the individual's spinal architecture. T12 to L1 and sometimes as low as L3 are transitional zones, and so is the coccyx on the sacrum a transitional zone. So you are likely to see problems in all those red areas, and you're likely to see restrictions in between them. So what are some types of mobilization? Neuromuscular mobilization would be things like Feldenkrais exercise, Alexander exercise. Neuromuscular mobilization means using exercises or active movements in order to restore joint function. So, as I mentioned in my Golf Biomechanics Manual, Eat, Move, and Be Healthy, there's techniques in there that are very effective. For example, there's Feldenkrais exercises in the zone exercise section that are designed to normalize joint function and therefore restore energy flow. Muscle energy techniques. Muscle energy techniques means using, again, muscles to move joints. You use the energy of a muscle to move the joint. Those techniques are quite specific and usually require training from a skilled professional. I teach muscle energy techniques to Chek practitioners, and they get more and more comprehensive as you go through the training program, because I don't actually want to teach a lot of the techniques to students till they get to Chek level 3, because there's quite a high level of responsibility with using mobilization techniques so you don't hurt people. Then you have manual therapy. Now, we have primary, secondary, and related tissues or symptoms. So whenever you're doing any kind of mobilization, you have to look at what's the primary problem. My hip joint, for example, what are the secondary issues? My hip may be giving me pain because of problems in my bladder, constipation, whatever it is. And then we have related tissues and systems. So what are all the connections that I have to look at? The primary is usually what people think to be the pain, but we must remember that there are secondary and related tissue systems that have to be involved, and oftentimes what we thought was primary turns out to be secondary or related, but is actually a symptom. Okay? So some tips for mobilizing your body effectively. One, it's always wise to get evaluated. If you have anything other than just a little niggle here and there that you need to work out, little training stress, little sore back from gardening, those types of things are comfortable and easy to do on your own, and you know you're doing it effectively because the problem goes away fairly quickly. But in general, because of the complexity, as I showed with my totem pole, it requires a very skilled practitioner, which unfortunately, as many therapists and doctors as there are in the world, we have a serious lack of skilled doctors and therapists. We have a huge abundance of people that are just reading textbooks and doing what they were taught to do by a medical profession that is largely still operating on Newtonian isolationist principles that are extremely outdated and ineffective, which is why you have all these people running around with all these health problems, even though we're spending billions of dollars and it's not doing much. So get evaluated. If you have any kind of legitimate problem, you can go to checkconnect.com and locate Chek practitioners near you and HLC practitioners. Chek practitioners at level 3 and 4 have the most knowledge and experience, especially when it comes to head, neck, jaw problems and the more complex systems. Another one here, do not heat a hypermobility. Many people use heat on these injuries, and many physical therapists use ultrasound on these painful joints, especially in transitional zones. Heat over those transitional zones whenever you have an instability like that or a hypermobility. Heat makes ligaments more lax. Ultrasound penetrates quite deep into tissues. So you can, for example, do ultrasound over a shoulder joint, make the capsule much more lax. It'll feel a little better because it moves fluids and there's other effects of the heat itself, but when it comes right down to it, it'll make the joint problem much worse. So if you have pain from laxity in joints, you need to ice those tissues. Ice puts yin energy in there and causes natural contraction or tightening of the tissues due to the energetic effect and other therapeutic functions of cold and ice on the tissues. Next, breathing. Whenever you're doing joint mobilization, there's always going to be a pattern in which the breathing supports or antagonizes the mobilization. Without going into a long, complex explanation on it, it can be as simple as this. When you're mobilizing, such as mobilizing a shoulder, either breathing in with the mobilization or breathing out will make the mobilization easier. Whichever one feels the most natural, if you're aware of your body, is probably the way to go. But because respiration, breathing, affects every single muscle and joint in the body, every part of you is involved, if you're breathing against the mobilization, your results will be poor and you may irritate the system by moving things above and below the problem area. When you're mobilizing, you want therapeutic pain only. Some people are just too aggressive for their own good. You should not have pain after your mobilization session for any length of time. If you have pain for a few minutes, like a little aching because you've moved a locked up joint, if it goes away quickly and naturally, that's fine. But if you're waking up the next morning and you're in pain from joint mobilization or tissue mobilization, you're being way too aggressive and you're probably making yourself worse. When you're mobilizing joints, joints are usually mobilized in what's called bouts. A bout is 6 to 8. So for example, if I'm mobilizing someone's C7T1, I might be mobilizing that vertebra with pumping movements, and 6 to 8 of those pumping movements, and then giving a person a rest is a normal plan. Now, mobilizing joints manually requires a fair bit of training, and you can hurt people, but if you're mobilizing yourself, just be aware of what you're doing to yourself. No more than 1 to 4 bouts. If you're trying to mobilize a joint and restore function, and you have no experience with what's going to happen, start with 1 bout of 6 to 8 mobilizations. Wait a few hours or a day at least and see how your body responds. If it feels good, then you can try 2 bouts and then successively. Doing more than 4 bouts of mobilization could be a problem because you could irritate the system. If you need that much mobilization, you need the help of a skilled therapist. Don't rush. Mobilizing tissues and joints in a hurry is a waste of time. The body is very, very sensitive to your self wind up. If you're psychologically wound up, you've already defeated the purpose of mobilizing anyhow. If your mind's tight, your body's tight. When your mind's loose and relaxed, your body will follow suit. Hydration. One of the biggest causes of joint mobility problems and tissue mobility problems is lack of water drinking. Your connective tissues are largely made of water. And whenever you don't have enough water in your body, fascia starts to congeal and get thick and bind down, disrupting joint function. Muscles don't work as well. And remember, all cartilage in your body is a storage site for water. So if your body gets low enough on water, it'll start extracting fluids from cartilage, such as your hip joints, spinal joints, and we have a huge percentage of the population that is that dehydrated. So there's no sense mobilizing your body and your tissues if you're drinking soda pop coffee and garbage all day instead of drinking proper water. Next, always look at the correlations that I've talked about, many of which are in my book, How to Eat, Move, and Be Healthy. If you look at page 121, there's a chart in there that shows you exactly which organs connect to which spinal nerves, and therefore you can identify which muscles are related by knowing the spinal segments. On page 100 and 101, you have a correlation of chakra centers or zones and what are the related functions in tissues. And then on page 101, you have a list of the common psychological themes that create disruption in energy flow, tissues, and joints in the body over there. So safety and security relates to zone 1, for example. That way you can do a better job of being effective in investigating what the actual cause of your own challenge is. The beauty of it is the body's always giving you feedback. So if you have problems, say, in your L5S1 or your legs or your hips, the body would be saying, look at your ideas and your concepts and your behaviors around the theme of safety and security in your life. And this might sound airy-fairy and weird to a lot of you, but the reality of it is this is well documented by hard science. I could list more references than you could ever read. So if you're reacting to what I'm saying here and saying, oh, that's bullshit, well, that's exactly the stuff joint limitation is made of. It'll mirror that behavior back to you. So what are the correlations? Body-mind correlations and soft tissues. Remember, soft tissues and joints are a working system. You don't have joints without muscles controlling it, and you don't have muscles that are not wrapped in fascia and surrounded by fascia. So the entire body is involved in this, so you always have to look at what are the soft tissue correlations. A surgeon by the name of Hilton, back in the late 1800s, if I remember right, developed a law which is still effective today. Hilton's Law says the nerve that innervates the joint, for example the shoulder, innervates the muscles of the joint. That means whichever muscles cross the joint, and the skin over the origins and insertions of such muscles. Okay? Hilton's Law, the nerve that innervates the joint innervates the muscles of the joint and the skins over the origin and insertions of such muscles. What does that mean? It means that if you're having a problem in a joint, you also have to look at the muscles controlling the joint because they're controlled by the same nerve centers. Therefore, any problem with a joint is automatically going to mirror itself in the muscles. Any problem in soft tissues will disrupt muscle function, which will disrupt joint function. So my point is, if you got a bunch of scar tissue, soft tissue problems, trigger points, congealed fascia, you can mobilize your joints till the cows come home. It's not going to work. You've got to deal with the soft tissue dysfunction. So joint mobilization, soft tissue work, psychoenergetics, and for-doctor self-management are all integral parts of mobilization. And then number 10 is always remember that your body's mirroring back your environment to you, internally and externally. So for example, if you've got rigidity in your thoracic spine, but you don't know how to set the ergonomics of your computer system up, all the joint mobilization in the world is never going to counterbalance 8 or 10 hours a day in a chair sitting with poor posture or having poor lifting technique, etc., etc. So we've always got to adjust the stressors in our internal and external environment to facilitate long-term resolution. So that's just a little brief look at the concept of mobilization. As I said, my courses take you much deeper. I'm just trying to share enough with you to empower you to learn more, study the resources that I share, and if you get excited about what you can do with the little bits that I share here, imagine what you could do spending 3 days to 2 weeks in a comprehensive workshop with me or one of my highly trained, highly skilled, very experienced instructors. Thanks for joining me today. Our next one, I believe, is on stretching, so I'll look forward to sharing more with you soon.